Well, hello and welcome to Ask the Doctor. My name is Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time today. On today's episode, we want to discuss a problem of TMJ. We had one of our viewers typed in a question where they've been dealing with jaw pain for a while. They've gone to a dentist. They've been wearing a night splint, which they don't find to be very comfortable. And now the physician is saying that they might have to look at surgery for the TMJ, and they wanted to know, is there anything at all that chiropractic care could do to possibly eliminate that problem?
I've known people that had surgery for TMJ, Jerry. It's a horrible thing. A lot of times it doesn't work, and you need more surgery, which includes adhesions and scar tissue. See, it's a very simple thing, Jerry. It's a joint, okay, the TMJ, and you can adjust it, okay? It's a very important area because there's 500 nerves that come down from the brain that go to the TMJ. So if the nerve is pinched, yeah, that's going to cause pain. That's going to affect functioning of what is called the masseter muscle, okay? But my philosophy, Jerry, is if all else fails, you adjust the patient, you adjust the joint, okay? We can use the impulse in there. We can use an activator adjustment, which is a handheld instrument. You can actually adjust it manually. So there's a lot of things you can do from a conservative standpoint. My philosophy here, Jerry, is you do the conservative first. If the chiropractic adjustment doesn't work, we can do physical therapy. Then you do the surgery. You don't want to put the cart before the horse. That's my philosophy.
Yeah, I don't think enough people really kind of try everything possible prior to surgery. Right. You know, they seem that I guess they have this philosophy where that's kind of like the easy way out when it's really not.
To me, it's the hard way out, because then you have the recovery. See, to me, the surgery's easy. You're just the passive patient, but then there's the recovery afterwards. The body has to accept the surgery. And then, of course, I mentioned before, there's scar tissue and there's adhesions. So they have to deal with that, okay? But see, to me, it's something simple that, you know, you just adjust the joint. In other words, if all else fails, you just adjust the patient. I mean, what a concept. So therefore, maybe the dentist or the medical doctor, he's not going to refer them there. So that's why we're doing these videos, is to educate the public that we have an alternative to surgery and drugs. It's called chiropractic. What a concept.
And the other thing that we really want to stress to everybody, I think, is that you work in conjunction with, say, a dentist who is, you know, having this problem. Well, you know, we're not saying that, you know, forget your dentist and just say, you know, you'll take care of everything. But you, and this is what I truly like about what you do here and how you work with your patients. You're not afraid to work in conjunction with other medical professionals in regards to fixing a problem.
Yes, because the patient benefits. It's like the best of both worlds. If there was one facility where you had an MD, a dentist, a chiropractor, massage therapist, Ayurvedic medicine, Chinese medicine, acupuncture, the benefit is to the patient because the patient gets the best of both worlds versus it's hit and miss, a little here, a little there. To me, that's kind of like a holistic approach. And the good thing about that is the patient benefits because of it.
Right. Which is definitely a unique, unique form of treatment. So, you know, if you're looking, you know, and watching this video today and you've been dealing with this, you know, TMJ, maybe you've got these problems when you're, you know, eating that sub. You know, I know a lot of people complain about that clicking, and you know, maybe you haven't even seen a dentist yet, but you've noticed that, you know, that clicking. Again, it's like that check engine light is on. There's something wrong here. Let's look at addressing that problem. So if you think you might have a TMJ problem or have been diagnosed with TMJ and are going through a current treatment, we encourage you to pick up the phone, call Dr. Goldberg here at Wellness Associates, come down. You know, you offer a free evaluation for a person, so that it's really a no-lose situation. Let them come in and see what you can do, and you know, really understand that there are alternative methods of treatment. And you know, when you do that, you're going to see that working together, you know, you're going to get the results. You know, the pain, you're going to, you know, decrease the pain, and you're going to be on the road to fixing that problem. So, you know, just pick up the phone, call Wellness Associates here, come down, see Dr. Goldberg, and see if he can help you. And if you've been scheduled for surgery, it is never too late to try something prior to going in.
I would.
Okay? Come in, you know, take care of everything possible before you go under the knife. I think that's just a great thing always to do for any type of problem. So now, also one of the things that we want to stress, if you're watching this video today and, you know, maybe you have a TMJ or maybe you don't, but maybe you've been dealing with some other issues, we encourage you to visit our website at AskDrGoldberg.com. We have a little Ask the Doctor area where you can go in and type in your question, just like this person typed in about dealing with TMJ and you know, can chiropractic care help with that? We'd be happy to address your question, and we're really open to anything. We're not, you know, we don't kind of sift through and sort through things and say, oh, we'll answer this and won't answer that. We'll address any question that comes in, because I think that's the the approach that you
Yes.
take here.
Yes.
And you know, we really encourage people to take an active role in your healthcare, get educated, get the proper information you need. Then you can make a well-educated decision on the best road for you. So with that, thank you very much for watching our video today on TMJ. And again, if there's anything we can do to help, feel free, call Dr. Goldberg. You know, continue to check out the episodes, and we really look forward to seeing everybody on our next episode. Have an awesome day.